Hi everyone. Welcome to our next webinar for Medic Mentor. Talking today on self-confidence and dealing with failure. Can everyone hear me okay? Dr. Kennedy is also joining us on the live chat, so if you do have any questions, please go ahead and post those there, and then I'll deal with any questions as well afterwards. So one of the reasons that we wanted to do this webinar is mainly because obviously you just had your summer holidays, exam results have come out, and whilst we really hope that all of you have had really good results, we know that that's not always the case. That's something that I experienced, particularly at my A levels, where the results weren't what I expected, and it can have quite a big impact not only on you but on getting back into school and things like that. So we wanted to share some of the things that I do to help deal with that. I think one of the big things that I found as a challenge was actually dealing with those results and not getting what you expected was actually acknowledging that it made me feel pretty crap. It feels like the world's ended, and sometimes that's how other people treat it as well. A lot of students come across teachers saying, oh, that's it, you're never going to get into medicine. And we know at Medic Mentor that is definitely not the case. So I think if we first sort of start talking about exam results, there has to be that period of time once you've got your results that you actually acknowledge that, this is not what you're not happy with them. And, you're going to feel a bit upset and you might want to have a cry, and that you need people to support you through that. But I think also you have to be quite realistic with yourself that, whilst there is going to be that time that you want to have a cry and you don't really want to talk to people about it, you do actually need to reach out and accept help. I usually set myself a day or a couple of days where I'm going to feel sad, I'm going to be upset, I might be a bit angry, and then I'm going to pull my socks up and get on with it, And I think when you're talking about exam results in particular, it's worth sitting down and having a look at what you've got exactly, how far you were off the next grade boundaries, and you need to really evaluate the options that you have going forward from there. Whether it is that you can resit, or whether you're in the situation where you can swap subjects or things like that. And this is where the reflection part comes in handy, really. I tend to have a think about how long I've revised for the exams, how far I was off the grade boundaries, whether the grades that I'd been getting in the practice papers, if I'd done any, whether they were in line with what I actually got in the end. And I think for a lot of people, the reaction to not doing as well in exams is to simply say, oh, well, I'll study harder next time, or I'll study longer, rather than studying 4 hours a night, I'll study 6 hours a night. And sometimes that's not always the best thing to do. And that's something that I definitely fell foul of when I was studying for my A levels, was that I thought if I just studied more, that would sort it. And I think realistically what I should have done was look at how I was studying. I found that I was making myself a lot of notes, but maybe I didn't necessarily understand the concepts that I was making notes on, so that when I had to use that information to answer exam questions, that's when I was losing marks. So I think, once you've had your cry and you've got cross and things like that, and you've sort of drawn a line under that and said, okay, I've dealt with that. I've dealt with how I felt getting these results. Now I want to look forward into how I don't end up in this situation again. So things to look at with exams is, did you study? Because obviously that's quite important. Did you give yourself enough time to study to the level that you would have been happy with? What sort of grades you'd been getting in practice tests and things. They're usually pretty indicative of what you're going to get in the real thing, and how far you were off that grade that you wanted. If it was a fact that you were a mark off, or you were 10 marks, or you were 20 marks, then you might want to approach that a little bit differently. And then think about how you've been studying. You know, is the way that you're studying actually working for you? You know, are you studying too much? Are you studying not enough? Are you studying in the right way for you? For me, I'm quite a visual learner. I don't like sitting still for very long, so I need to study in short, sharp bursts with a lot of pictures, with videos, not just making copious notes, or just sitting and reading. It doesn't work for me. Some people can sit and they can read, and that, you know, works for them. And I think, you know, looking back and thinking about how your studying is working for you is quite important. It's also quite a mature way to tackle these kind of problems. And then when you've got a little bit more of an idea yourself about how your sort of action plan of what you're going to do going forwards, whether that is, you know, create a study timetable and study a little bit earlier, or do more practice questions, it's always worth talking it through with people. I find that talking a plan through with other people and being able to bounce ideas off them about what things I can change is quite helpful. And it doesn't really matter who you talk it through with, whether it's family, friends, or even teachers. And actually, if you find that it's a particular subject that you seem to be struggling in, you know, every time, then actually talking to that subject teacher is a really good thing to think about. And they can often share insights into things that are quite helpful, and they usually know sort of which resources can help you as well. I'm a big fan of study groups. It's not something that I did when I was at school or when I was in my first degree, but when I was in my second degree in medicine, we had a study group, and we met once a week and we set topics and we did presentations to each other, and we made little revision sheets for each other. And I actually found that so helpful, and I saw the reflection in my grades, that actually having that date every week that I needed to prepare for, and sharing those ideas, different links, YouTube videos, different resources, just different ways of people looking at things. And that's actually something now that I think about that probably would have really benefited me when I was in school. And this is actually something you can use your Medic Mentor School Societies for, that, you know, having those revision sessions together in the lead up to your exams. But not letting it impact on studying for your other subjects also. And that's definitely something that I found helpful. And I think just, you know, acknowledging that it does suck, but it isn't the end of the world. There are things that you can do. There's always more you can do. That's not necessarily more hours in the library, you know, to help sort of offset what's happened. And then, you know, reaching out as well. I think it's quite tempting to shut yourself away, not talk about it, you know, bury your head in the sand. But actually, that's not going to get you anywhere. It's not going to help in school, and it's certainly not going to help in medical school. It's quite important. And actually, you know, if you're struggling for people to talk to, come and talk to us. You know, we're quite happy to be sounding boards for things. So for me, I think the first time I got A-level results, I was really unhappy with what I got. You know, I think it was the first time I got a D, and it was awful. I was quite fortunate that I had some teachers that were very helpful, and they helped me with revision. But people didn't really understand that, you know, I wanted to get better grades, and that it was really important for medicine. And when I applied from high school, didn't get any offers, didn't get any interviews. You know, I didn't have the grades. And between AS levels and A levels, I was advised to drop an A level. At AS, I got 4 Bs, and I was quite happy. You know, I'd got a D in my first exam. I was quite happy that I managed to bring it up to a B in the second, and I wanted to keep going with the 4. You know, the ones that I did maths, chemistry, biology, and English literature, and I was advised to drop English lit. I'm quite stubborn, and I didn't because I really enjoyed English literature, and I thought it was quite important to have that balance with the science subjects. You know, and I went on and I managed to get 2 A's, a C, and a D. And obviously I didn't get into medicine the first time, but I got 3 offers for biomedical sciences and molecular medicine. And I went off to Sussex to do molecular medicine, had an absolutely fantastic time. And I think for me, being able to go away to uni and not have the pressure of it being medicine straight away was really helpful. And I did really well in my first degree. And got into medicine the second time as a graduate entry student. And I actually got 3 offers for 3 different medical schools, which was great, and I think definitely worth the wait. I think then getting into medical school, I've definitely approached it with the attitude of, I was going to work my ass off and I was going to be in the top 10 and, constantly studying and everything like that. Surprise, surprise, that's not what happened. I started on a graduate entry course, which meant that I started in the second year of an undergraduate course. So I sat my first exam for my degree like 12 weeks in, when everyone else had done like an extra year, and didn't do too badly. But it was a really rough ride. And I think actually managing my own expectations would have helped me a little bit better, because I think at the end of the first year I was really, really disappointed when I wasn't in the top 10. And I was facing exam resits and things like that. And I started questioning whether I was good enough for medicine. Should I have gone to medical school? I was a bit older than everyone else. I'd got another 3 years of studying. And I think that's something that a lot of students face, and whether that's facing it at GCSEs if they didn't get what they wanted, or at A-level and that they didn't get what they wanted, or even when they're in medical school and things are tough and you're not sure if this is actually worth it or what you want, what you do want to actually do in the future. And there are a number of ways that you can deal with that, with that sort of thinking. And one is to acknowledge it and actually think, why is it that I'm suddenly thinking, I don't know if I want to be a doctor anymore? Is it because things are not going as well as I hoped they were, or it's not what I expected? And whether that's in your exam results, or in the course itself, or where you're living, or where you're studying, or whatever. And then again, think about what the other options are. There was one point where I thought, oh well, if I didn't be a doctor, what would I want to do with the rest of my life? And everything I looked at, for me, I personally still came back to medicine, and I really couldn't think of anything else that I wanted to do as badly as I wanted to be a doctor. And I sort of stuck it out and graduated, and now I'm an F2 and I love it. Don't get me wrong, I wouldn't do anything else. But it's quite important that you don't just bury your head in the sand and think, well, I've applied for medical school and that's what I'm going to do. And if on A-level results day you suddenly think, actually I don't want to be a doctor, then that's okay. But make sure that you make an informed decision by really thinking through why you're thinking the way that you're thinking. And it might just be that you've gone to uni, maybe you're missing home, or things aren't going as well academically, but there are things you can do to change that as well. For me, again, it was changing up how I was studying, and things like my study group really, really helped with that. And actually, when I transitioned from preclinical to clinical years, that made a huge difference for me, because I was on the wards and I was seeing patients, and I could really see myself, being a doctor. And things definitely improved for me then. I also had people that I could talk to about it, that didn't, sort of get really shocked when I said, oh, maybe I don't want to be a doctor anymore. And they supported me through it as well. And it doesn't matter who you talk to, whether it's friends or family, people you work with, or people from a medic mentor, or whatever. As long as you talk it through with someone, they don't always have to be involved in the situation either. Sometimes someone that's removed from the situation is helpful as well. And again, a lot of it is this reflection, is this, trying to analyze the situation, and dealing with the emotions sort of separately, and allowing yourself that time to feel that, whether it's happy or cross or angry or, relieved. deal with how you feel, and then when you've done that, think about the situation and what's happening and what you can do to change it and whether you want to change it. Is definitely an approach that I would take myself. And the other really, really important side of it, with dealing with failure, and it's actually something that most of the people I know that are doctors are really, really bad at, is actually celebrating when things go well. I think particularly you guys will find GCSEs, A levels, medical school, foundation applications, specialty applications, we're really, really good at knowing what the next step is and what the next hurdle is. I'm about to start applying for my core surgical applications, and that's all I can think about at the moment. And I was the same when I was applying for my foundation jobs and when I was applying for medical school. That's the next step is all you can think about, and getting your work experience and getting your grades and getting a part-time job and writing your personal statement and preparing for your interviews. And then you get in, and then it's, oh my gosh, I need to prepare for moving to uni and starting medical school and all these textbooks and PBL work and your first exams, things like that. But actually, when things go well, so when you get in, when you pass your interviews, when you pass your first exams, actually celebrating and telling people, and texting your mum and your dad and your grandma, telling them that you've passed or that you've got an 80 in your first assignment or whatever, and actually acknowledging that you did that, and you worked really hard and you got what you wanted. We're all really, really terrible at it. I'm always wanting to think of the next step and wanting to push myself that bit harder and take on something new because it's a challenge and it's something that you can succeed at. And it's actually one of the things that we're working really hard at Reddit Mentor to change as well. And one of the things that we're doing is having our awards ball at Christmas to celebrate, the achievements so far as an organisation, the achievements of our medical student scholars, of our school society leaders, of our teachers and things like that, because we don't do it often enough. We don't take that time to stand and say, actually, do you know what, we're pretty awesome and we've done all this awesome stuff, and taking that minute to say that. And it's actually something that my grandma made me think about. And we were out for dinner, and actually ran into someone that I went to school with, and I was still in uni at the time, so I was on my second degree at medical school, and they asked me what I was doing, and I said, I'm still at the uni. And my grandma jumped in and was like, she's at medical school, she's going to be a doctor. And she sort of pulled me up afterwards and said, you should celebrate the fact that you're studying to be a doctor. You're doing something that you always said you wanted to do. Don't sort of dismiss it by just saying, oh, well, I'm still a student, I'm still in med school. And actually it's something that's stuck with me even now. And I find myself picking other people up in the same things. Just because you don't get the grades you want first time, or you don't get in first time, it doesn't mean it's over. And actually getting into medical school, whether that's the first time, the second time, the fourth time, the 10th time, is a huge, huge achievement. 1 in 10 people get in. That's 9 people that don't. And when you think of it that way, rather than thinking of, oh, well, I'm still in med school or I'm still in uni, it definitely changes your perception. And I think it's one of the things that helps with the whole self-confidence thing, is actually thinking, well, actually, no, this is everything I have achieved. And I'm still working towards, for me, being a surgeon, I'm constantly still striving to be a better doctor, and a better mentor and a better teacher. But I've already accomplished, so much of these things. And, that's the same for you guys. When we sit down and we talk to you about, what kind of work experience you've done, or, what kind of extracurriculars you do, the amount of you that'll say, oh, well, I did my Gold Duke Edinburgh, or like, oh, well, like I was national champion for ice skating or judo or whatever. And you're so flippant about it. And I think, gosh, well, I wouldn't even know where to start, You have to own that experience, and it's quite a difficult thing to do. And this sort of leads on to another thing that I've started to notice as well. And this is actually picked up in a lecture that I was watching on the TED Talks, which I absolutely love, by the way, that everyone should check out. And the fact that particularly girls, but guys do it as well. When we talk about our experiences, we tend to use phrases like, oh, I was really lucky to have been given this opportunity, or I was really fortunate to have spent time with this surgeon or this doctor, or, I was really happy to have been selected head boy or whatever. And actually, if they're experiences that you went out and sorted out yourselves, or, if you put yourself forward to be head boy or head girl, or you decided to do Duke of Edinburgh because it's something that you've never done before, or, you trained day in and day out to be this world champion, you weren't fortunate, you weren't lucky, you worked damned hard for it. And you really have to work on acknowledging that. And that's a subtle change that you'll see in yourselves, in your personal statements and in your interviews as well, that actually you're taking ownership of those experiences. And that's really important in medicine. You have to take ownership of your responsibility and actually of your role as a doctor. And it's, don't get me wrong, it's not something that comes easy. And you will catch yourself, when you talk about what you've achieved, finding that you're saying those things, saying that you were fortunate to have, to gone on this summer school or gone on this work experience placement. But actually, be more specific and say, well, actually, I decided to do this because of this, and actually I learned this from it, and it led me to do all these other things. And, be honest, is it something you would have ever thought of doing? If you'd have told me, 4 years ago that I'd be director of education for something like Medic Mentor, I probably would have laughed at you and been like, oh yeah, right, there's no way I would be running national events or mentoring students or anything. At that time I was trying to keep my head above water and get through med school. And actually for me, if you'd have said, oh yeah, you'll be an F2 doctor, and you'll be learning to treat all these patients and learning things like operating and things like that, I wouldn't have believed you. And the way that I went about doing that was actually just trying to challenge myself and actually spending time with people that I like and that share the same beliefs as me. And one of the things you'll find in Medic Mentor is that a lot of us all have our own stories, and some of us have come to medicine straight from school, some of us don't. But everyone's gone out there and got what they wanted, and taken ownership of those experiences. And that's something you can practice. And actually, if you start practicing it now, when it comes to interviews, it makes answering all those questions a lot easier. If you tell me about your work experience, well, actually, the way that I arranged my work experience was this. It's something that I really enjoyed, and it made me think about this, and that's something I would never have really considered before. Or if it's tell me about your hobbies, or tell me about what you do when you're stressed, or it's like, well, actually, when I was in this particular situation, this is what this is how I reflected, and this is what I went on and did about it. And that, then that skill then sticks with you. And, when you're at medical school and you're introducing yourself to people for the first time, or, when you're thinking about putting yourself forward for a scholarship or a research project, keep those thoughts in the back of your mind. Actually, what amazing things have I achieved so far? Why do I want to be awesome? And don't let people tell you can't be. Not teachers, not lecturers, not parents, not friends. If you want to do it, then go out and do it. I'm quite fortunate that I've got, and there you go, I just said it. I'm quite fortunate that I have really supportive parents. And grandparents and friends. But actually, it was me that went out and said, well, I want to be a doctor. My parents didn't push me into it. My grandparents didn't push me into it. Don't get me wrong, they love that they can say that I'm a doctor. But it was me that decided to do it, and I went out there and, got that opportunity for myself. And, when you sit your exams, it's you that sits them. It's not mum that sits them or dad that sits them. Sometimes I know they wish they could sit them for us. So you really got to work on taking ownership of those experiences. And that's where a lot of the self-confidence comes through. Now, I'm not talking about being cocky. I'm not talking about, walking around like you own the place, or like you're, the next big thing. It's about acknowledging that you have a right to be there. Particularly if you're one of our students that's transitioning from A-levels to medical school, and some of you may go to schools where there's, 20 or 30 of you in a class, and you're suddenly going to be part of, 100, 200 year at medical school. And it can be quite difficult to figure out where you fit in that. And, if you're one of the students that is the top 10, that is in the top 10 or whatever, then great, but not everyone can be the top 10, and there's other things to identify yourself whilst you're there. And this is where things like school societies and then university societies and sports groups can really help. I sort of call it's like finding your people. For those of you that are Grey's Anatomy fans, probably get the reference there. But it's finding people with shared interests. That's what a society is, and whether that's a specific area of medicine or a specific hobby. Kiel has like a Quidditch society, and they just won the Premier League in Quidditch. I did not know that was a thing, but it's a thing. And actually spending time around people that share that interest, can help build your confidence, and also expose you to opportunities that you maybe didn't know about. One of the best things I think I did when I was at med school is I did a summer research project. I'd done in my degree before, my biomedicine degree, I'd done some lab work, and over one of the summers in my first year, when we still had the lovely long summers, spent some time working in a lab on a research project. And it was skills that I had already got, but it was really nice to be able to use those. And actually in the 8 weeks, we actually managed to get some good results, and I was able to present that, sort of down the line at a conference. And that was something that I really enjoyed. And but why it was really beneficial for me was actually at the time I was resitting one of my medical school exams. And I think it would have been really easy for me to have said, oh, well, actually, I could just keep doing this lab work and, to actually really want to still be in medicine. And one of my tutors said, well, if that's what you'd really wanted to have done, then you wouldn't have bothered applying to medical school. You'd have gone and got a job straight after your first degree. And I think when things are tough, it's quite easy to cling on to things that are going well, whether that's extracurriculars or whether it's school that's going well and extracurriculars aren't going well, or, things at home aren't going well and schools, sort of a bit of an escape. Then it can be quite easy to blind yourself to the stuff that you need to be focusing on to improve. And the same thing with like A-level subjects. If there's two that are going really well and one that isn't, it's really easy to come home and revise for the ones that are going well and that you're doing really well at, and ignore the one, or sort of just bury your head in the sand a little bit about the one that isn't going well. And a lot of it is having the maturity to acknowledge that that's what's happening, and actually then making yourself sit down and work a little bit harder on the one that needs your attention. And again, it's this reflection and this self-awareness, and it doesn't come easy. And obviously, I'm talking from hindsight. I've been through what you guys are currently looking at, and it's very easy for me to tell you that these are the things that I learned and that work for me, and they may not work for you. But if you can take the time to try and figure out what will work for you, then that's where you're going to have, your benefits, really. And there's a lot of things that you can get involved with Medic Mentor for extra support. Quite often along the time when things have been difficult for me, whether it's academically or personally or whatever, is having someone there that you can talk to. And at school, there was a couple of teachers that were really, really helpful. My English and my chemistry teacher were there for me, when things weren't going very well. And then in med school, my research tutor, and then the Medic Mentor guys, and I was just fortunate that I found my people, and that they've been there for me. With Medic Mentor, we have things like the gap term program for students that are taking a gap year to reapply after A-levels, who I work very closely with, which I'm really excited about, to give support. We have the school societies that get support from their regional mentors and from the national meetup events, and even our mentors that come along and help us at the national weekend, the insight events. And I think the personal mentoring definitely, is a huge, huge part of the summer school, and is a benefit that I know the summer school students really, really love as well. But it doesn't necessarily matter who your mentor is. You know, if it's just someone that you can click with really, and that you feel that you can talk to. You know, sometimes it's a family member, sometimes it's a friend, students in older years. You know, and that's another really good way that the School Society scheme can help you. You know, if you've got students in year 13 that are going through it, students in year 12, year 11, and actually then, you know, I think it comes full circle when actually you find yourself in a position of being a mentor. My first ever Medic Mentor event that I did was in Cardiff. It was an Insight into Medicine Day, and one of the students and the parents came up to ask me a question, and they'd been told by their school that, you know, they'd not got certain grades at exams, and that meant that, you know, they weren't going to get into medical school. And actually that was a direct mirror of something that had happened to me. You know, one of my teachers had turned around and said, oh, well, you know, you're not going to get into the unis you've applied to with the grades that you've got. You know, and whilst at the time that may have been true, it wasn't particularly helpful. It wasn't very constructive. And it was, you know, such a buzz for me to be able to be in that situation where I could say to these students, you know, actually, hold up a second, like, who are they to tell you that? And, you know, and we talked through, you know, the options of resitting and, you know, approaching the school about that. And then also obviously about the alternate routes into medicine, which, you know, Medic Mentor has people that have been through every which way, you know, whether it's foundation courses or transfer courses or graduate entry or, you know, undergraduate degrees or going abroad. You know, we have people that have done all of that, you know, and you'll find them on the website, you find them by email, you know, you can drop me an email also. And actually, you know, just hearing it from people that have actually done it, and as a mentor, that is really rewarding, you know, and actually working with students and, you know, hearing back from you guys when you've got your exam results, and, you know, and then seeing you as Medic Mentors is great. And I think that's also a really, really big confidence booster, you know, when you realise that your experiences can help other people, you know. And that's the same in school as well. You know, when you're sitting your A-levels, you know, think back to how it was when you were sitting your GCSEs. How helpful would it have been to have a student in the senior years that had said, you know, actually, you're going to want to study this way, but try and study this way. Or, you know, actually, this textbook was really, really helpful and it's not one that everyone knows about. Or, you know, actually, I found this revision technique really helpful. Or, you know, even set up study groups for them. Because, you know, if you think about how you used to look up to A-level students when you're in GCSEs, or even when you're in, you know, year 9, that mentor relationship can be really, really powerful. And that's definitely something that I would encourage. And again, you know, you go to your interviews and you say, well, actually, I've had this experience of helping the generation, you know, that's coming after me. That's basically how medicine works. You know, the people that teach me to be a doctor are the guys that are, you know, doctoring at the level above, and the level above that, and the level above that. And that's only going to happen more and more in medicine, because medical degrees are moving more clinical and you're spending a lot more time in the clinical setting, even as students. So yes, that's definitely something I would think about. I'm going to pop over and have a look at the live chat, because I don't have any questions on my screen at the moment. Bear with me a second. But I hope that's been helpful. And I know that some people have personal circumstances that they want to talk through. And that's absolutely fine. You can drop me an email on my Education at Medic Mentor email, or you can get me through the Medic Mentor website. My profile is on there, and you are welcome to drop me direct messages on there, and I will get back to you. Do bear in mind that I work full time, so sometimes it takes me a little bit of time to get back to you. Okay. Do bear in mind that I work full time, so sometimes it takes me a little bit. Okay, so we've got lots of questions, and oh wow, we've got Dr. Kennedy and Dr. Siva going there. Thanks, guys. Okay, so Fatima's asked, how would you decide on what medical school to apply to, knowing what the UK CAT averages are this year, especially if your school has an early deadline? I think Dr. Kennedy has dealt with that on there. Admissions tutors are really, really helpful for stuff like that as well. Oh, and he's talked very scientifically about risk and probabilities. Thanks, Dr. Kennedy. Um, okay, we've people sitting their UK cats. Good luck. I am a big fan of like fake it till you make it. So you got to walk into the UK cat like you're going to get the best score you've ever had. Um, Again, for the Grey's Anatomy fans, I'm also a big fan of the superhero pose. It's supposed to make you feel more confident. And it is basically standing with your hands on your hip like a superhero wearing a cape, and thinking positively at the same time. Obviously maybe not, in the middle of your UK Cat Test Centre, maybe before you head off. But yeah, you guys have got this. You've done the preparation. You've studied hard. You've got to walk in it like you're going to boss it. And this is another thing for interviews as well. Trying to get into the mindset that this is your opportunity to show off everything that you have. And actually, I'm a little bit weird. I really enjoyed my medical school interviews. Don't forget to smile. These are people that are meeting you for the first time. And you have all these amazing skills. You've written this amazing personal statement, and they want to interview you. You've sat these GCSEs, you're sitting your A levels. You do all these amazing extracurriculars. Why wouldn't they want to give you a place? Okay. So advice about choosing unis if you weren't able to attend open days. Choosing unis is quite difficult. Yes, Dr. Kennedy's right. Speaking to some of our mentors on the website that went to different universities, there are university groups on the website. If you go to the group directory tab, you can find the universities that you're interested in, and there are mentors on there that you can ask questions about, what it was like studying at those universities. Some universities have started doing like virtual open days as well, where you can, they do like 360 videos of the campuses and things. And try and think, well, what's important to me about that university? For me, when I applied for med school, it was quite important that there were certain extracurricular things available. So I fenced, so I wanted to go to a medical school that had a fencing team. And actually that did narrow down some of them. I wanted to go to a problem-based learning uni because I'd done a degree where I'd sat in lectures, and I wanted something a bit different. I said before that I'm really bad at sitting still, and that sort of PBL interactive way of learning really suited me. Uni as well, and a campus uni, which Keele is. And I'd also, my baby sister was 1 year old when I applied for medical school, so I wanted to be a little bit close to home to be able to spend time with her as well. So for everybody, there's quite individual criteria about what you'll want from your university. And the reason that it's important that you choose the right place is at the end of medical school, you're ranked in your medical school. And when I was talking about the top 10, it's ranked in deciles, and those deciles are scores that help towards your first job. But that's done nationally. So you're ranked in your medical school into deciles. And then, the top 10 in Keele will get the same points as the top 10 in Sheffield, as the same points as the top 10 in Leeds, when it comes to their first jobs. So obviously you want to pick the universities that you're going to perform better at, because you want to be higher up in those deciles. And just a caveat to that, I wasn't in the top 10 decile when I graduated med school, but I still got my first choice F1 and F2 jobs. So there are other sort of contributing factors towards that as well. The other book to look out for is the Med Schools Compendium book, which Medic Mentor are releasing very shortly, which is a complete guide of all the medical schools, the different curriculums, different entry criteria, and and help sort of on how to whittle down the 36 to your four choices that you get. Oh. Okay, so I'm just reading through all your questions. Okay. Hamad's asked about why do we do the situation judgment test if it doesn't contribute to the overall UK CAT score. So the reason that the situation judgment test is coming in to UK CAT is because actually that's something that medical students sit at the moment. So when I was talking about the end of medical school and the deciles and how you're ranked nationally, the other way that they score you when you graduate is the situational judgment test, which you sit as a medical student. And we know that with admissions, what happens is it tends to feed down. So at the moment, situational judgment is something that you sit at the end of medical school, so they're starting to introduce it into UK CAT. The MMI interviews is something that medical schools have done for a while, and that's come from the way that they interview for core training when you're applying to be a medic or a surgeon. So a lot of things tend to scale down through the levels, and that's where the situational judgment test is coming in. It's likely that over the next couple of years they'll include more and more of the situational judgment in the UK CAT because of the fact that it's a measure that they use at the end of medical school. Okay. Okay, so do you have any tips on self-confidence when it comes to the trap of comparing yourself to other applicants and students? Oh my gosh, yes. Don't compare yourselves to other people, because, and I know, don't get me wrong, I know that is easier said than done, and it's something that I spent an awful amount of time doing. And actually, until I went out and found some opportunities for myself, and started to be able to appreciate my own experiences, I wasn't able to sort of switch it off. I think, one way to look at it is that we are all different, and every single time you meet a patient, they're going to be different. You can have 6 patients that present with right upper quadrant pain, and it be gallstones, and they will behave completely differently because they come from a completely different background. They experience their symptoms in a completely different way, and they all have the same pathology and they all have the same surgery to fix it, but they're different people. And the way that you approach it has to be different. Some patients will be worried about the fact that they're going to have an anaesthetic and they're going to be put to sleep. Some patients will be worried about the fact that they're going to have a scar, and you have to manage that differently. And this is no different. Your situation, just because you're applying to medical school and your best friend is applying to medical school, is completely different. The right medical school for you will be different from the right medical school for your best friend. And your best friend won't have had the same experiences that you have had, and it is again about that taking ownership of those experiences and actually looking inward and thinking, okay, so what do I have, and what do I want to improve on, and actually going out and finding those experiences for yourself. Being able to turn around and say, oh well, actually, I applied for that summer studentship because it's something I wanted to do, and because of that I got to go and present at a national conference, and actually the research that I've done is now a PhD, and they make a huge difference to the world of type 1 diabetes, and I did that because I wanted to, and no one can take that away from you. That's your experience, and it's something that just comes with practice, really. And that self-awareness that I was talking about, it's a very mature way of looking at things, and it is quite challenging, but if you can check yourself when you realize that you're starting to measure yourself up to other people, that will help. But you do also need to acknowledge that, unfortunately, people are always going to compare you to other doctors they know, or to other people at that level, and will try and standardize you. And unfortunately, people that are at your level will try and put you down. And usually when people start to do that, it's because they're threatened, and it's because you're actually acing it, and they're scared of you. But it is literally sort of head down and sort of that self-awareness and that self-reflection. Okay, so sorry, I'm still catching up with some of your questions. Um, 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 okay, so there's a couple to take here. Macy, you got 4 A's, 4 B's and a D in GCSEs and you're starting A levels this week. Great, enjoy. Do you think it'd be hard to study medicine at uni? I mean, medicine, don't get me wrong, it's not supposed to be easy, and I don't think that there is actually much correlation between, you know, studying and finding medical school difficult. A lot of the things that you won't anticipate that you'll find difficult about medical school is not necessarily being in medical school and studying for medical school. It is things sometimes for people like the social situations and dealing with suddenly having to manage your finances and deadlines and going home to see parents. And for me, I worked full-time, worked part-time throughout my medical degree as well, so managing all of that and and actually having to remember to do laundry, to have clean clothes and things like that sometimes you find more challenging than actually studying for medicine itself. But yeah, Dr. Kennedy's right. Yaz, there are options open to you as well. It took 3 years to do A levels. This is quite a specific query, and it might be worth if you drop one of us an email, we'll be able to respond to you with a bit more information. We have resources and things available for that. Laura, you mentioned being a gypsy, a GP with specialist interest, and you're asking about whether you need to mention that you have an idea of what path you'd like to take your medicine in your personal statement or interview. I think it depends very much. There's sort of two schools of thought here. One is that it can be quite dangerous to write or to stand there at your interview and say, I want to be this, when actually your experience of medicine is very limited. Even my experience of medicine as an F2 is very limited. There are tons of medical specialties, and spending a week observing a doctor in them is not really experiencing it, until you've worked in that specialty for sure. And actually, some people make this decision or don't make this decision for a number of years. I think it's interesting to analyze why you have an interest in that. If it's because when you talk about your work experience that this is something that that you've come across and that you'd be keen to look at going forward, it's that's fine. And I think for me, I've pretty much always wanted to be. Well, I've always been interested in surgery, and that's something that I talked about. But what I did acknowledge was the fact that my experience is very limited, and that I'm actually really keen to explore everything else that's out there, whilst I'm in medical school. And actually, it's one of the things to be a bit aware of when you're in medical school, that it's quite tempting, particularly if you've got a bit of an idea about what you want to be when you grow up, for want of a better term, to sort of ignore any other opportunities that present themselves to you in medical school. And actually get really blinkered and say, oh, well, I want to be a surgeon, so I'm not going to get involved in this teaching event that's for GPs, or I'm not going to go to this lecture that, looks like it might be quite interesting. Medical school is your time to really, really explore all of these specialties, even if it's something that you maybe don't think that you want to be interested in. A lot of my colleagues and myself included have gone through thinking that they want to be various different doctors, and sometimes actually that does link with your confidence levels. There was a point where I thought, oh, actually, am I clever enough to be a surgeon? And actually, it's about realizing that there is a lot more to being a surgeon than just being clever. Being clever is quite important, but the criteria that they look at when you're applying for surgical jobs is more than just that. And it's about those skills that we talked about before. It's about being able to teach and being able to mentor, being able to communicate effectively and be a good team player and a good leader. As well as having pretty decent grades and having sats make exams. Okay, and Millie, that's the same sort of answer for you, really, about mentioning your interest in surgery in your personal statement as well. So guys asking for my email, I just posted it on there now. That's me. The other way is Rebecca Yates is my profile on the Medic Mentor website. So you can find me in the mentor directory, drop me a message on there as well. Is that okay? Fatima's asked, is it important to pick medical schools that you like, or should it be strictly be based on whether you're likely to get an interview? I obviously explained a little bit about why it's important to pick universities that you think you're going to do well at. I think it very much depends on whether they meet your criteria and why you've got that criteria. You know, like I said, for me, there was a few things about the teaching structure and you know, the extracurriculars that were important for me. And then in terms of what, you know, whether you're likely to get an interview, you know, one of the questions that they're going to ask you at that interview is, why have you applied to this university? You know, and if you sit there and think, oh well, it's because I thought I was going to get an interview, that's going to come across. Whereas if you've done your research about the university and you can talk about it quite confidently, and you know, you sort of putting yourself in their university, you know, and creating that picture of you as a student at that university, that's going to, it's way more likely to be successful than I thought I'd get in, you know. Okay. Bridget, that might be a really good thing to put in your put in an email to one of us. Gives a bit more information, and we can sort of reply to that question a bit more directly. Any more questions? So things to think about. Basically, if things have gone wrong, why have they gone wrong? You know, and actually take time to acknowledge that things are a bit rubbish and it might feel like the world's going to end, but actually, you know, the strongest people, it's called resilience. You pick yourself up and you reflect and you get on with it. You know, try and start practicing these skills of reflection and you know, self-analysis, and try and pick up on what you can do. I'm a big fan of plans, so plan A, plan B, plan C, but also acknowledging that they're only plans and things change and your plans change. You know, and one of the big things that we want to emphasize at Medic Mentor is that, you know, you're not alone. Even if you're the only student that's applying for medical school in your school, you know, there are always people you can talk to, whether that's teachers, whether that's family, whether it's friends, whether it's us, you know, whether it's another organisation. Please, please, please don't feel like you have to go through it by yourself, because, you know, you don't get through medicine by being an island. You know, you got to be part of the team, and we're here to support you. You know, and then it's about paying it back and celebrating when things are going well, and that's so important, you know, and actually acknowledging the people that have helped you get there. You know, being able to turn around and say to people, actually, do you know, when you did this thing, that was really helpful, and it meant so much to me, and you know, I'm so grateful that you did that, and actually that really worked, and actually acknowledge the things that didn't work. You know, for me, spending so much time worrying about what everyone else was doing and comparing myself to other students, you know, it was a waste and actually quite damaging to me. You know, when I started focusing on what I could achieve and what I wanted to get out of being in medical school and having this opportunity, you know, that's when things really went from sort of zero to hero for me. And I got involved with Medic Mentor, and you know, and over the 2 years that I've been involved, things have just gone from strength to strength, and that has had a direct impact on what I've achieved as a medical student and as a doctor. You know, and if you'd have, like I said, if you'd have asked me 4 years ago, could I imagine doing this, then I would have not believed you. So hang on in there. And also to all of you guys starting your A-levels or about to start medical school, I gotta enjoy it. Starting medical school, starting your A-levels, starting the next step on that ladder, on that treadmill that I was talking about, is really, really exciting. So yeah. So Eric, you asked about good things to do as a year 12. Get involved with Medic Mentor school societies, information on the website about that, setting up a group for students at your school that are interested in medicine, dentistry, veterinary, psychology, or whatever, and those healthcare careers, and start liaising with Medic Mentor on that and attend some of our events. Other good things in year 12, yeah, Dr. Kennedy's mentioning some amazing things on here, volunteering, teaching, mentoring. Michael, you've asked what university societies or extracurriculars would you recommend? Recommend for what? For personal statement, for interviews, or for when you actually get into medical school, what societies would I recommend then? Can you just clarify that a little bit more for me? Yes, no? I mean, basically, I'd recommend anything that you're interested in, and also things that you've never thought you'd try. I got into fencing when I was at Sussex doing my molecular medicine degree completely by accident. I went to an open session with my housemates and just got really involved that way, and actually ended up being women's team captain and organising a tour to Boston, which we'd never done before, and having just a great time. And I actually met my best friend through that. Oh, you meant when you get into university? Yeah, literally just anything that spikes your interest. And actually, if there's not a society there when for something that you think there should be, then set one up yourself. There are loads of weird and wonderful stuff. Sports that you've always wanted to try, things like skiing or snowboarding, or most have riding, or I mentioned Kiel have their Quidditch team that's they're Premier League champions. All sorts. Kiel have got a makeup society, or live action role play. Any of those things that sort of spark your interest, really. Something where you get to spend time with people that aren't medics. That perspective on life, and actually being with people that are outside that medical school bubble can be really, really good for you. And it's definitely something I found really, really helpful. One of the things I also did when I was at med school is I worked part-time for the Students' Union, which meant that I was working with other students, and again had made some really good friends through that as well. Fatima, you've asked, how can we check personal statement lengths without going directly onto UCAS? In Microsoft Word, you can take the word count, and it will, if you click on word count, it will give you with or without spaces. Oh yeah, Dr. Kennedy's jumped on that one as well. Oh yeah, Kiel is definitely a very magical place. It has lots of squirrels. Cool. Any more questions, guys? Don't forget, you can get in touch with us through email, through the Medic Mentor website, and obviously through our webinars as well. Good luck. Don't forget to own your experiences. You are a superhero. You guys have got this. You've been working really hard for this now, and if things don't go right this time, there's next time. Oh yeah, and the Medic Mental helpline as well. The numbers on there too. Thanks, Dr. Kennedy. Okay, so I'll just wait a few more seconds, and if there isn't any more questions, then I'll close this webinar. But thanks for joining us, guys, and I hope it's been helpful. Okay. Okay, so I'm going to stop the broadcast now. Thanks, guys, and I hope to see you all at Medic Mentor events in the near future. Okay, bye.